All right, welcome everyone. We're going to get started here just shortly. Sandra and Vishnu are in the room. They'll be joining up here. So if you guys can hit that button in the top left corner there, we'll get started. So welcome to our second to last session, everyone, for Health Impact Summer. We've had 3 jam-packed days of lots of great discussions. We're going to start this particular discussion really focusing around inefficiencies and sometimes the unnecessary burdens that we end up creating because of technology. So after we've been talking for 2.5 days about technology, we want to say, well, how do we make this stuff smarter so it doesn't add more burden? And so we've got a couple of great panelists here. We've got Vishnu and Sandra. Sandra's got a really cool job at Hackensack. She's in charge of the Center for Discovery and Innovation. That's a new one, and I love it. Our assumption is everybody just knows what to innovate, but really there's a lot of discovery that has to go on, and that's why I'm really excited to have Sandra here. Vishnu is, of course, a longtime friend of Health Impact, and many of you have seen him at a number of different conferences that we've held, and he's done a lot of innovation work at a number of different companies. So we're going to have a good time talking about that. So before we get started, Sandra, I'd love for you to introduce yourself and what you do at Hackensack. We'll do the same with Vishnu, and then I'll get the questions started. And for the audience, remember that you've got the chat. Please keep your questions rolling. I'll be keeping pulling those out and weaving them into the conversation. And then, of course, at the last 10 or so minutes, if you would like to come on live on camera, we can do that as well. So please keep the questions coming into the there's a Q&A box and a chat box. If you just want to have chat, have it there. But if you're asking a specific question, it's helpful to use the Q&A button. With that, Sandra, tell us a little bit about yourself and what you do at Hackensack, and we'll do the same with Vishnu.
Hi, everybody, and I'm grateful to be here. I'm also grateful that we are not the absolute last one of the day, because we know that we're the only thing standing in your way of the cocktail, of Friday afternoon cocktail. So at least we know we're not in your way there. Sandra Elliott, I am the Vice President for Life Sciences and Innovation at Hackensack Meridian Health, and as Shahid said, it has a wide encompassing role. The Director for Center for Discovery and Innovation, which is our basic lab research, research labs that are targeted at regenerative medicine, infectious disease, and oncology, and driving innovation into the clinic as quickly as possible. Driving internal innovation from the front lines, trying to solve some of those problems, those barriers that we all face. With frontline ideas, and also bringing in external companies to help us target some of those key challenges that we're facing. So super excited to be here today and talk about barriers, everybody's favorite thing to talk about, right?
Especially on a Friday afternoon, right?
Exactly.
So welcome, Sandra. And one of the things that's special about Sandra's role in life sciences innovation is typically you don't actually have this role except at the very biggest academic medical centers and research centers. Most hospitals do not actually have discovery and innovation centers in this same way. So she's got a lot of experience here. Ask some of the harder questions, like there's vaccination questions. There are questions around how do you actually tie together some of the digital health with digital therapeutics. So remember, digital health could be things like EHRs, they could be mobile apps, et cetera. But digital therapeutics could be in actual human biological diagnostics, chemistry, physics, all the stuff that goes beyond just the digital aspects. So that's why it's really great to have Sandra here to talk about those. Vishnu, tell us a little bit about yourself and what you're working on these days.
Sure. Likewise, a pleasure to have you on this panel. Shahid, thank you so much. Good afternoon, everyone. My name is Vishnu Saxena. I'm a Digital General Manager Healthcare at the Dateless Group. We are one of the largest healthcare software firms in the world, transforming care across the whole continuum of healthcare. We are new to the United States, and I will talk more about how we are essentially solving this problem. And it is always a pleasure to be, with Sandra, a fellow New Jerseyan, and I'm excited to join this panel. This topic is very near and dear to my heart. The reason is, being a grandson and a son of physicians. And I was speaking with my father this morning, and I said that, hey, I'm gonna speak on a physician burnout, and he said, do you see me burnout? And he laughed.
That's That's perfect.
Yeah.
In fact, it is really where we should start out, and maybe if you want to give just a couple of colored comments a little bit around clinician burnout. When you hear that, Vishnu, both as a son and a grandson of physicians, as well as the number of docs you hang around, what do you hear when you hear clinician burnout as an actual problem? And is it really we outside the clinician community that talk about that, and the clinicians don't really talk about that? Or are they also discussing burnout in those same terms?
Yeah, and I think this is being a clinician itself is a very noble profession and a stressful occupation. When it comes to my father and grandfather, they have lived their life in a very basic and basic, I would say, a healthcare setting, without use of much of technology. But here, fast forward in 2021. It is really, has reached to an epidemic level, and the cause. If you see, we all know, but mostly, it's a varied. I think the causes are varied and many, and one of the greatest contributor, and I think, in my opinion, that I have seen is the staggering workload of electronic paperwork. And the documentation need that meaningful use actually has brought on them, and the quality measure has brought on them. And then, of course, on the financial reimbursement and liability protection, those coverage and all. So I would say more than half of clinicians, as per a variety of reports, as you can see, they report burned out. And most of the time, I think the hamster wheel of documentation and the reporting tasks are the key factor. They're not able to spend time, with their, with the loved ones, with the family, and we all know the pajama times. 2 hours after coming back to home, depending on the workload. So it actually essentially it eats lots of their time, their quality time. From family and away from their patients. And if you go to a physician's office, they're talking to you, they are doing documentation. So that's very evident. That's very evident as a physician, as a consumer, we can see this is not right. Mm-hmm. And I think, in my opinion, the technology is a solution as well as the cause. So depending upon how we use it and how we essentially now, after so much of learning that, yes, this is really an epidemic, how we can solve that. So yeah, I'd love to share more in terms of how we are solving the problem.
Sure. No, we'll get to that in a second. Sandra, how would you think of, just from a discussion point of view, are we framing the problem properly in terms of burnout? And here's why I'm asking is that if you look at burnout purely from a digital health perspective, meaningful use, et cetera, has caused a lot of grief, but maybe not greater than or less than other grief that physicians face anyway. But is it possible that we have actually upcoming new technologies such as artificial intelligence, automated diagnostics? I firmly believe that as we move into proper digital therapeutics, that we will actually help truly reduce the workload. Forget the burnout for a second, but just workload on physicians to get them to do the things that only they can do, right? Which is beyond the easy diagnostics, right? The easy diagnostics, hopefully we can get, just like today, when you want to get a pregnancy test, you don't need a doctor to do a pregnancy test, right? You go do a pregnancy test, and that's the digital therapeutics of the past. What are some of the ways of thinking about this problem of burnout and workload that is not just purely around digital, if any?
Yeah, it's interesting because as Vishnu was talking, I was also thinking about the kind of two categories in my mind. One is just the traditional workflow of being a physician, a clinician, trying to take care of patients. And then there's the operational I was about to say operational hazard, but the processes and the culture that are embedded into an organization like ourselves, that adds to that burnout, the inability to make a decision, the inability to move forward and try and make things better. And I say that because at the end of the day, I think, a lot of clinicians, they want to evaluate a problem, come up with a diagnostic, a potential core for addressing the problem. What's the core problem? And then prescribing kind of an action step, the interventions. And at the end of the day, that's kind of the core. And with the follow-up being, did that intervention work? So if you think of it in a very simplistic manner, it begins to help you understand where the buckets of opportunity may be to actually automate and make things easier, because it's the hassle. And hassle is, like you were saying, Vishnu, is automation itself should be a solution. It shouldn't be we're automating because now we can automate. And I think a lot of us in the healthcare industry have also automated along a revenue cycle, not a clinical pull through. In other words, how do I assess patients, diagnose the core problem, and then provide the treatment and interventions in an efficient way? And I think one of the things we as an industry have to think about is when we're talking about AI, when we're talking about automating data sets, et cetera, and even down into or thinking about how sensor technology will enable diagnosis or treatment options down the road, how do we make sure that at the end of the day, it's facilitating the clinician to operate, as you were mentioning, at the top of their license, where they're using their skill sets for decision making and evaluating whether or not those decisions were the right ones or need to be modified going forward. So I think sometimes it is a very simple kind of thing, a way to think about it. And it begins for us as an organization to frame kind of how do we evaluate where the solutions may need to be targeted in order for us to have an outcome of not only clinically improving what we're doing, but doing it in a way that our physicians or practitioners feel good about what they're doing as well.
Yeah, and Vishnu, in a minute, I'll ask you about, what are the tech that you're actually working on from the Dateless perspective and delivering to help here. But Sandra, I want you to kind of elaborate a little bit on your title from the life sciences and innovation side, not just innovation. What is it on the life sciences side that everyone else is missing that you think Hackensack is properly focusing on rather than just the digital part of it?
Yeah, I think, it's interesting because one of the things that we've been able to try and really do, and we've got a long way to go yet, is really bringing that frontline life sciences labs, the labs to the floor, if you will, and the bedside to say, okay, what are the clinical challenges as a physician that you're facing in taking care of X patient population? And then how do we as a lab, how does our basic scientists, how do they focus and collaborate with you to resolve those problems? So for example, on the life sciences side, is everybody is fully engaged in different ways on COVID-19, really beginning to understand how do we diagnose faster, how do we implement changes that make a difference in how we take care of those patients. So for example, one of the things that came up is as variants started to evolve in the marketplace, we wanted to make sure that we had a good sense on, number one, what was coming into our marketplace in any of our hospitals or clinical settings. Were the variants taking hold, and how is that potentially impacting care and treatment decisions, and even vaccine decisions for that matter? So they developed a really rapid screening technology that any positive COVID patient, we actually did a rapid screen on them to see if they had any of the variants. So if I've got a variant that's really about how the virus spreads, that's a different kind of challenge than an escape variant, for example, where vaccines are not going to be as critical. And what we started to also see is that some of the monoclonals did not react as strongly, or the viruses didn't act as strongly to one monoclonal versus another. So you began to make treatment decisions based on that information. So it's a very simplistic, but yet just thinking about operationalizing that in such a way that it makes it, so it wasn't science for science sake, it was science to better understand what's going on in the community, but also whether or not we needed to reevaluate how we were making treatment decisions based on the type of COVID-19 you actually presented to the organization with. So those are, that's what the physicians are they get very excited because they're scientists at nature. So when you start putting them together in a way that helps the life sciences labs begin to understand how treatment decisions may differ based on what they can provide, it's a very different game changer. And it also energizes some of those people who are getting somewhat overwhelmed in how they're taking care of some of these patients.
Yeah, that's so true. And you hear about, of course, you have places where everybody's heard of Mayo Clinic that does the research, and then they have literally direct access to patients all the time. So research moves faster. And then when research moves faster, you get to the bedside faster. When you get to the bedside faster, you fix patients and get them out of your hospital faster.
Absolutely.
That's why I was excited to see, that title. It's only a few years old that you guys have had that title, and especially the discovery title is even more recent. And seeing that, nearby in the Northeast is very, very exciting. So Vishnu, talk a little bit about some of the core technologies that you guys are focused on at Dateless and other customers you're working with in helping hospitals and health systems with helping reduce the burden and overwork, either just related to digital biology, digital chemistry, and life sciences, or purely on the digital health side. Nothing wrong with that. Just tell us where you fit.
Yeah, no, I think this is great and, great question, Shahid. So just to give you a little bit context and the background. So at Dateless, our software powers around 6,000 hospitals, 5,000 labs around the world. We handle 28 million inpatient admission, 3 billion diagnostic test results. So we were talking, Sandra was talking about diagnostic, and we handle 3 billion diagnostic results, 330 million patients record per year. So we do everything from prevention to end of life and in between. And this is really very humbling, right? When you see, the depth and the breadth and the scale and the volume. And as we call it, life flows through our software. So our tagline, our logo, our mission itself is a full of responsibility. So you can imagine what the level of responsibility that we carry, our software carry for a variety of our healthcare stakeholders. And thousands of physicians and nurses use our software 24/7. So I wanted to give you a little bit of context in terms of the scale, depth, and the breadth of our healthcare. Mm-hmm. And it is in our DNA to provide a better clinician and consumer experience that reduces physician burnout and increases productivity and the business outcome for the healthcare enterprise. And I wanted to highlight 3 key areas where our digital health platform, we call it a Digital Connect for Health, in short, DC4H, a new version of what was previously known as Open Health Connect, is bringing to real life difference in physicians' daily life. So one of the key engagement and one of the key example I wanted to talk about is clinical alerting. It is critically important. But before I get into that exact details, I want to take a step back and touch upon the approach we take to address the physician burnout across our platform, which is DC4H. That is essentially to shorten the time and distance of care for our care providers treating the patient. So the whole philosophy that guides and the North Star is how can we provide the information which is so contextual in an actionable form, so that doctor and nurses don't have to go and search for the information and waste their precious time. So that is what is our North Star. How we can shorten the time and distance to care. And think about the last wave of the transformation that we had in the world when we moved from the letters to emails. I recall I created my first Yahoo email in 1999. I was in college and my cousin was here in the US. I wanted to communicate with him. So I created, my first Yahoo mail in 1999. That was the, kind of the first major transformation. And the next wave of the transformation is contextual information delivery. So the email could be long, email could be, like 3-4 pages long, or maybe, if you talk about anything. So that is good to read, but where is the context? So if we can tag, if we can nudge the context in that 3-4 page email, I think that's what we are all about. So the idea behind is how, if we can wrap the context around the information I'm delivering to that physician, I'm shortening my physician's decision-making process as well as time it takes to treat somebody. So that is the North Star that essentially guides, our philosophy, how we, in terms of how we approach in order to reduce the physician burnout. So our platform strategy is very simple. As I mentioned, shorten the time and distance to care. And we really do it in many ways. And we make semantic data relevant so that it can shorten the time and time it takes to make decisions. We wrap around additional capabilities such as AI and their first and second cousin, NLP and ML. So that is what contextual delivery is powered by these emerging technology that we were talking about.
Yeah, that makes a lot of sense. And in that case, Vishnu, then it seems like, as you look at natural language processing, notes automation, et cetera, so one way to really judge the value of a technology is how much less time are you doing the useless things, and how much more time can you spend doing the valuable things. And I think when you do things in context, you do text summarization, you do NLP, that sounds fantastic. How about, Sandra, on your side, when you look at things like artificial intelligence, instead of thinking of it, kind of like this panacea, which it's not, it's just a bunch of math and science, guys. So, you apply math to this problem and you get results. You put in, a billion pieces of data, you get 2 pieces of data out, which is a prediction based on some input coming in. Where do you see artificial intelligence and more like ambient voice, natural language processing? Where does this fit at Hackensack inside the innovation department?
Yeah, there's a couple of things to mention here. I think one is particularly anything that can be automated as much as possible that are operational processes. Mm-hmm. That's one of the areas of focus for us, because we should make taking care of patients, and particularly the core processes of ordering and communicating and bringing key information up, as automated as possible. So it's still amazing to me how many processes in our organizations still depend on hands and people doing certain things where that could be automated, basically. So we're really kind of focusing in on that. So why do I have nursing staff, for example, which are needed in different areas of the organization, abstracting clinical information for registries, for example? Mm-hmm. Why aren't we using better our resources very differently? So it's one of the areas of opportunity, I think.
And just out of curiosity, Sandra, why do you think that is? I mean, especially you've got somebody like Vishnu whose company makes these things. Why is it that there is these kinds of things that it's almost like silly stuff? Or, by the way, just in our last Health Impact Winter, our keynote was, the title was Getting Rid of Stupid Stuff. Like, why do we do stupid things like this? Is it just inertia or something more sinister than that?
I think it's not as sinister as much as it is, what's the word I'm looking for? It's legacy. And I think sometimes legacy it drives more of those decisions. And sometimes when you've got so much on your plate and something's working and you've got to provide that data, people have a hard time making those changes there versus bigger issues. So they'll kind of, until they're forced to really drive efficiency, then they're not necessarily going to automatically do it. Because if it's working, it's one less hassle, one less fire. We're so fire oriented. Fire's in front of us is what we focus in on. Yeah. So I think that's been more of the challenge. And particularly as a network where you're adding organizations to that network, you have a lot of legacy that comes in. So I think a lot of it is quite honestly culturally based, and really getting people to understand that we're not trying to take jobs away. We're trying to replace and automate what can be automated so those individuals can do bigger, better things to impact an outcome, a clinical outcome, if you will. And it's a hard sell, but it is, really what the mission, and you've got to be consistent with it, and you've got to be, transparent about what you're doing. And I think it's a critical issue to communicate. I think the other thing that we think is extremely exciting is when you start taking NLP and adding additional analytics to the actual voice and the waves of the voice waves. I'm well over, I'm just way over my head. There are companies that are starting to dive into the actual sound of voice. Mm-hmm. And how we can diagnose certain things like early stage of depression. Maybe you have a clinical issue, or maybe your heart failure is getting worse. So thinking of it as beginning to identify those patient populations and quote unquote diagnose potential problems well in advance. So it's easier for the clinician to begin to understand how they can help that patient much earlier before it becomes much more complex. And it's an exciting realm, and there are a lot of people starting to work on that. And we're super excited about what that may enable us to do, because it helps us democratize a lot of the technology potentially, and really get it out to masses very differently. And then hopefully prevent some major complex situations that those patients may face.
Yeah, absolutely. And in fact, that's a great way to think about it. And when you extend that, and to our audience, remember, you can continue to ask questions, and then we'll bring you guys on in about 10 minutes or so. But please do ask questions in the Q&A box. So Vishnu, extending a little bit of what Sandra was just talking about with respect to how do you guys look at choosing, and what do you notice as a common set of features in leaders that are able to prioritize, getting rid of the silliness, it's not sinister. I completely agree with Sandra there. It is legacy. But if we can't pay back our debt, you don't get to make more investments, right? So if you think about legacy software, legacy hardware, legacy processes as debt, then you can say, look, if my debt keeps increasing, I can't possibly invest. And that's really what's happening here, is legacy debt is keeping mounting. So when you see you're dealing with hundreds of millions of patients across thousands of different facilities, what is common amongst those leaders that you feel are able to prioritize investment over debt? And how could other audiences members learn to do the same thing?
No, I think this is the key, and the technology debt is a big problem in our healthcare industry, and one of the key issue why we are not able to move faster is because there's too much of legacy application written in the previous years of the languages, and we talk about consumerization, but you can't achieve the consumerization unless and until the underlying layer, which is IT infrastructure and all, also can be modernized and live and deliver to the expectation that we have from the consumerization strategy. So I completely get that. So in my experience, the way we have seen successes while working with variety of health systems is where we can actually leverage their existing investment, and while giving them a flavor of the technology to be able to solve some of the current problem, while not overly disturbing their current investment, whether it is their EHR, whether it is their current workflow. So leveraging their current infrastructure, keeping their investment in our solution that is solving their current problem minimal, that resonates very well. So for example, I was talking about that clinical alerting solution. So this is an example that this is a great engagement that we did with one of the top health systems in New York City, where we are automating this critical lab results. So our Digital Connect for Health platform was already there, and they have Epic, they have everything. So we suggested proactively that maybe you have this problem, and we understand this problem is actually affecting your variety of physicians, and you can solve that, and we can solve that. So it started with an idea. It started with a kind of taking a problem centric approach and coming up with a solution, while not talking about the cost and all, unless and until the buyer, the stakeholder from that health system believes, yes, this is the solution. It is solving my problem. It is not costing me. It is not creating me to go around my current workflow. So that was a pretty good way. So what this engagement, if you allow me to finish this really quick. So it is about intelligent alerting and notification process, where we are increasing the physician productivity and their experience. So lab results will always be there, right? But what is important is context around the lab results, that will be delivered to the workflow and empower the physician making that decision. So what we are doing is sending automated notification to the care team on their mobile devices, and visualization on the dashboard to clinical operation command center that they have for monitoring and escalation. So it means that the care team doesn't have to wait and watch for the results. And the intelligent workflow notification, which is Digital Connect for Health, that gives the clinician peace of mind. If I'm the clinician, I will get a peace of mind that I will get the critical information quickly and automatically. I don't have to worry, and that the follow-up procedure will be in place. So I think, taking a problem-centric approach and, bringing that as a solution that does not overly bothers them, their investment. And I think that's the way to go.
Yeah.
And I can share some more examples the way we are actually, contributing into physician productivity and freeing up the physician and their staff time if we have the time. Otherwise,
yeah, absolutely. And really, the way that for our audience members to think about this as they're thinking about Q&A is, you remember back in the early, probably late 80s, early 90s, when pagers first came out, who were the two groups that first embraced those? First, it was the drug dealers. Then it was physicians. So it's not like physicians and clinicians don't want new tech. What they want is the new tech to give them more freedom and flexibility than they had before. So and if you think about a pager, you're like, it's a pager for God's sakes, what is it? No, it's a freedom enhancing device, right? If you had a pager on your belt, you could go see patients whenever you wanted to. Otherwise, you had to sit by a phone, right?
Right.
That's what we want to see. What Vishnu and team is talking about at Dateless is these kinds of things, whether it's the AI part that's automatically picking things up, whether it's the notification and alerting, the grouping, the context management, what freedom and flexibility to now care for more patients have we given to nurses and doctors and others? That's gotta be the simple rule that we have to use on each of these technologies is, what could I do tomorrow that I couldn't do yesterday? And if that means you have to stay at the computer longer, that ain't no benefit to anybody, right? Yeah. So is it freedom or is it not? So that sounds like what you're providing is more freedom to go care for patients.
And if I can take a quote from our dear friend Russell Shrestha, he often says, "If innovation done right makes the technology invisible." So that is what we are trying to do. And just to give you a quick example, relates to your original question again. So leveraging the health system existing investment. So, for example, another example that I wanted to share is, again, Digital Connect for Health is freeing up, the physician and their staff's time. So that, if you can free up a physician's time, I think nothing like that, right? And if you leverage a health system's existing investment, for example, of course, Epic, for example, a CRM like a Salesforce, so that can greatly produce value and reduce the burnout. So on an average, we all know that a significant time of physician and their staff goes into answering basic patients' questions, such as prescription refill, appointments, procedure preps, and all, right? And one of the engagement that we are doing, again, with this large health system is where Digital Connect for Health is powering the integration between Salesforce and Epic in a manner that the call doesn't go to the physician's office and it gets routed to the call center agent. And Digital Connect for Health brings all the relevant information from Epic to the patient in a 360-degree longitudinal patient record format to the agent's dashboard. And this is the huge respite for physician practices, right, as they handle large volume of the calls on a daily basis. So again, this is an example. Leverage existing investment. Do not disturb the current, the workflow, because that's the key. And that
makes a ton of sense. So one thing I would like to do is, and anybody who wants to come on camera, please just raise your hand on the thing. Otherwise, you can continue your questions in the chat. But Sandra, what I'd love for you to talk a little bit about is, what are the technologies, solutions, capabilities that you're not hearing about from vendors and solutions providers coming to you that you really wish you would? You're like, damn it, it's Friday now. It's almost the end of May, and nobody has come to me with this solution, and that's really, really what I need. Are there those kinds of things where you're like, you would wish that folks were bringing to you? Or you're like, I'm tired of waiting for all these guys. I've got my own discovery center, my own innovation center. I'm just going to get what I need.
No, I think, it's interesting because I think there are a couple of different ways to think about the technology from that perspective. I think that there's a lot more sensor technology that can come to the table. And I think, trying to get people to begin to think about sensor technology in the, going back to Vishnu's comment about context, but sensor technology in the context of what is the problem I'm trying to solve? What is that clinical problem I'm trying to solve? I think is yet to really come to the table in a great way. I think, in some of the areas in cardiology, for example, there's a lot of application, but I don't see it coming as rapidly as I think it can. So I think there's a lot more of the sensor technology and then integrating it into data sets to help make decisions. But I think that, I think the next kind of wave is really going to be cellular therapy, cellular-based therapies, and the sensors driving an understanding, a better understanding of what's going on with people at a very precise and cellular level. And I think, so genomics and next-gen sequencing is a good example, right? Where you're taking a tumor and you're sequencing that tumor to understand very specifically your cancer and which technologies are really going to, at a genomic level, be the right technology for you. So the question then becomes, how do we leverage that same kind of direct, precise measurement, if you will, even though it's DNA or RNA? How do we do that with the basic chemistry of cell function, for example? So I think there's a lot of that's yet to come. It's super exciting, but I think once you can, again, it goes back to workflow, as Vishnu said, is once I create a lot of data sets, new data sets, it comes into how do I get it, how do I analyze it, and how do I make decisions based on it? And if it's not kind of in a traditional kind of workflow, it's going to be hard for people to understand. They're going to see it as overwhelming.
Yeah, and for our audience members, especially the innovators in the audience, the stuff that Sandra was just talking about, when she says cellular, has nothing to do with cellular phones, right? It has to do with the specific cells in our bodies. And I'm only saying that because often, when you think of innovation at a hospital health system, you get inundated with just the next patient engagement tool or the next mobile app for remote diagnostics for this one very particular thing. But synthetic biology, digital biology, these are two terms that you'll hear more and more over the coming years. Synthetic biology is today what the transistor was, back in the 50s. So you had, for example, the idea that you went from vacuum tubes to the transistor. That one migration is what allowed us to do everything else. That's what's happening literally this decade in the 2010s and 2020s is synthetic biology is going to now allow the transistor moment. And what makes synthetic biology really cool is it makes our cells programmable.
Yep.
When it makes our cells programmable, all of us as software engineers, we've got digital people, start thinking about not just programming zeros and ones in silicon, but our genomes. CRISPR is one example. There are a bunch of other gene editing techniques coming. So that's the kind of stuff that we need to kind of like open our aperture a bit beyond just the digital pieces, because biology is very, very complex. But I think we're going to be able to program biology in this respect over the next few years. So we've got a question came in. Sandra, so Chris asks, Sandra, who are the typical stakeholders in health systems that would be most interested in things like leveraging sensor technology? Would that be your role, or could it be broader than your role?
I think it's my role for sure, as someone in the organization with a role like mine. I think the others are going to be your chief medical officers, and maybe depending on the positioning and the value prop, it could actually be your CFOs as well. Mm-hmm. So I think it's if there's a value add, because you're going further upstream or you're taking on a lot more clinical risk or financial risk. In order to take on more financial risk, you've got to manage clinical risk. And that's really, some of the folks that I would target very specifically. But it's usually going to be very high level executives in the organization.
Perfect. And Vishnu, to let you chime in here, two parts of the question for you is, one, you guys are doing, gathering sensor data, et cetera, into your dashboards and especially the command centers, right? Those are those big monitors that you can see of all the stuff that's going on. So when you think about sensors and more data coming in, Nick then asked the question, with more technology comes more sensory overload For example, airline pilots used heads-up displays, especially fighter pilots who have tons of data coming in. There could be a missile thrown at them while they have to watch the weather outside, et cetera. So the heads-up display model, it is noisy. Like if I'm not a pilot and I looked at a fighter pilot or a heads-up display, it would look like, who would understand this? But pilots go through thousands of hours of training, just like doctors do. So is the idea of the heads-up display, where you have clinicians using dashboards, et cetera, could that simplify these large data sets into ease of use for staff and patients? And if so, what's Dateless doing there at this point?
Yeah, so we believe in and this is exactly where we are going with the Digital Connect for Health as a platform. And I think as we go from a web to API economy, where everything is very API and integrated, driven, and the file is, the way of life, and I think getting the insights, whether it is like sensor data, what we are trying to achieve here is, again, going back to the context. If we are trying to get a sensor data, the vitals is about getting that patient, proactively in terms of monitoring that patient and making sure that we can do a targeted intervention, right? So it is all about getting the contextual information quickly, proactively into the right hand at the right time, so that targeted intervention can be done. So that's where we are focusing a lot in terms of aggregation, automation, and orchestration. So this is something that is our core to what we are doing in additional in Dateless overall, as well as particularly on the Digital Connect for Health platform. So it's all about ingestion, and how we take the meaningful information, insights out of that, and we give it to the caregivers. And in that process, we bridge the gap between the system of between the system of record, which is variety of system of record that we have a health system has, practice management, variables. We talked about sensors, you talk about claims data, you talk about pharmacy, you talk about genomics. So how we take that whole, ecosystem, whole variety of information from variety of sources, and contextualize it, and make it, that data that we turn into an actionable insight, and give it to the right stakeholders so that they can do a targeted intervention to produce a better outcome for the patient, and also, get a better, clinician experience for themselves.
Yeah, perfect. And so we just got a couple of minutes, and Sandra, I'd love for you to take us out towards the end here, giving us a little advice on how should these new technologies, and whether you're talking about something super advanced like synthetic biology, or relatively mainstream but coming up, which is AI, et cetera. What challenges are you seeing within your workforce on the innovation side, in your own innovation group, that makes it difficult for actually them to choose these solutions because they don't know what the impacts will be to your workforce? So just a couple of minutes on what are you doing and thinking about in terms of workforce as you're looking at these new modern technologies?
So one of the things that we're definitely doing is kind of bridging the gap of, I'll call it innovation, and trying to generate an innovative mindset within the culture of the organization, to what are we strategically trying to do as an organization. So we're trying to leverage those challenges or opportunities that our executives and our board are going to hold our executives accountable for, and working our way backwards with saying, okay, if I know, and I'll just use a very simple example, if I know that we want to drive hospital-acquired infections down, and I know that our executive staff and our CEO are going to be held accountable for doing that, how do I leverage that challenge and that opportunity to work backwards and say, what are the top ideas that you have, or top technologies that may be out there that are driving to that metric? Because at the end of the day, we've got to drive to a metric. And if it's a clinical outcome, a financial outcome, you've got to be able to to really tie the technology to something that specifically is a problem that people are trying to solve, or a challenge that they're trying to meet. And when you're able to do that throughout the whole organization, it makes it much easier to pull in and innovate in such a way that people that are stakeholders in the outcome are also stakeholders in the implementation of some of those new technologies.
Perfect. With that, I'd love to thank both Vishnu and Sandra for joining us here. And that last piece of advice was fantastic because everybody can understand it. Don't focus on the tech, go focus on what you're trying to accomplish on the business side, which seems like such an easy piece of advice, but it's really, really hard to do, to figure out who needs to do what in order to be successful. And if that's what you can train your staff to do on the innovation side, you've probably solved half the problem because you're targeting the right problem rather than a bunch of solutions in search of problems. That's fantastic. Thanks again for the advice, Sandra. Vishnu, thanks for joining us. We'll see you on our next Health Impact episodes. And please join us at our last session of the day, which should be on your agenda. See you there. Bye, guys.
Bye-bye.
Thank you. Thank you, Shahid. Take care.